Innovative models to deliver mental health support to communities in the midst of a pandemic are needed to prevent a mental health crisis. And we heard Patrick Kennedy talk about that as well. Collaboration among health system leaders from the hospital and community mental health systems must occur to assure safety and continuity of care. So if you've ever worked in a hospital or in a community care system, you know that this aspect is nowhere near as seamless as it should be. And that dates back again, as Patrick Kennedy referenced, that a vision of President Kennedy from now 50 years ago was to decrease the number of state hospital psychiatric beds and replace them with a robust national community-based mental health system. And unfortunately, as we know, only half of that vision got realized, and that's something we still deal with today. Like with many things, COVID now exacerbates that, and that continuity of care, that gap in continuity of care can be even more consequential. So, so the article, so then the authors of the article go into some recommendations based on their review of early emerging literature. Okay, and that includes trauma-informed ICU care. So we're all kind of familiar with trauma-informed behavioral health care, trauma-informed social work practice. So what does trauma-informed ICU care mean? According to the authors from our Journal of American Psychiatric Nurses. So social work and mental health interventions for patients and families. Getting social workers, and of course is a biased statement, right? But getting a social worker to every patient and family in the hospital, not just, I think they could use a behavioral health evaluation or social work services, meaning, that the attending decides, or someone brings it to the attending's attention, well, this person may need social work or behavioral health intervention, but really assuming that kind of everybody is so impacted these days, so much more impacted from an emotional standpoint and a stress standpoint, that getting those services, at least in an evaluation standpoint, to everyone who sets foot into the hospital. Providing mental health resources and education upon discharge, linking people with telehealth outpatient services. Again, assuming that every single person would likely benefit from at least some level of behavioral health intervention, even just a routine telehealth outpatient services, and social workers and discharge planning nurses in the hospital, the better they can have access to and make the point to look for providers out in the community who take people's insurance and are providing telehealth services to have access to that information and be diligent in providing it to people, to patients and families as they're leaving the hospital, whether they were hospitalized for COVID-related reasons or not. Mental health support interventions for the staff who are hospital staff, from housekeeping to medical tech to social work, nursing, physicians, all allied health, everybody who is in that hospital experiencing the significant increase in stress and prolonged stress exposure in the hospital. Occupational mental health resources, EAP programs, really doubling down on making sure that every employee in a hospital setting, at least, is aware and has access to an employee assistance program. I don't know of any, at least larger health care systems, that don't have an EAP service offering, but many staff, I do a lot of EAP work, but many staff aren't aware of it or are hesitant to access it for concerns of privacy or stigma. So really trying to get that education out to people. Support for illness and family leave, right? So in addition to the frontline healthcare workers have the same struggles that many of us do, which is, taking care of family members. If you're taking care of elderly parents, well, they're much more susceptible to exposure, right? So they need extra care, and children who have to now learn online. So working hospital shifts, imagine social workers and nurses and doctors and numerous other types of frontline healthcare staff were working overnight shifts, then having to come home and be somewhat of at least a teacher's aide for their children throughout the day. And how long can someone withstand that from a physical perspective, let alone a psychological, emotional perspective? Ensuring adequate staffing. Right. So some of the things I've read about, kind of anecdotally in the news are the stress upon staff when they've got more patients coming in than they can treat, and having and seeing sometimes fatal consequences. Right. People who are coming in for COVID or non-COVID complaints that are in serious medical, are kind of in a dire medical health situation, and they don't have the staff or the equipment available to properly treat them. Okay, and which leads to the next point here: a safe practice environment with the adequate personal protective equipment. So again, imagining that people don't have fresh masks every time they walk into the hospital sometimes, or there's not enough head to toe gear for everyone. It has to be incredibly stressful for those staff. Okay. Let's see here. Let me go. Okay. 2 more slides. Mental health support. So the last slide was really kind of focused on the hospital, and the hospital, hospital patients and families, then hospital staff. So this slide focuses on the kind of shifts the focus to interventions for communities. Okay, so access to professional telehealth-based treatment. Again, we need providers, and then we need to make sure communities, particularly when we know there are communities where a significant number of the members of that community don't have reliable high-speed internet access, or don't have the devices, don't have access to even a cell phone, let alone a tablet or a PC or they have computers that are old and don't have cameras embedded in them, like all our laptops do now, right? So making sure they have the equipment and the internet access. Insurance coverage for telehealth. So far, that's not been an issue. It was definitely an issue, and now I'm speaking from my own experience in private practice. Transitioning into telehealth was a little, I had a number of denials, had to go and clear up codes and stuff like that. But now it hasn't, at least in my own experience, it hasn't been a terrible issue, but it is a concern, right? What happens if insurance coverage abruptly stops for telehealth? That's going to be it's going to be a problem for a lot of folks, including me. So extended medication supplies. This is definitely something I'm also hearing in my clinical practice. Lots of clients with chronic conditions that are not behavioral health related, and some of what they're going through to get some of the medications that they don't, that are where the supply chain has been interrupted, either by, I'll give you, for instance, when the president was talking about hydrochloroquine and, saying that was the cure or whatever he was saying, well, suddenly there were more scripts being written for it, and significantly more people were taking it, well beyond the kind of predictive model of the supply chain. Well, that medication is commonly used for people with lupus. I did not know this until I had a client who has lupus tell me that the pharmacy has started sending out notice. This was earlier in 2020. It's a problem that appears to have since been resolved, at least from this one client's standpoint. But he was pretty scared because he was as many others were getting notices from the pharmacy that they may not be able to supply that medication to them as a part of their medication regimen for the treatment of lupus and the management of lupus. So, so medication supplies is managing that medication supply chain, let alone, a vaccine supply chain, is going to be critically important. Increase provider mental health training, especially with regard to teletherapy and COVID-specific stress, including variances of effective COVID stressors along lines of historical oppression and disparity. So you see in brackets here, I added a few things. So one, not all providers are comfortable or even really educated in how to use the technology. Some providers are very hesitant to try teletherapy, although, and this is purely anecdotally, everyone that I know personally, it's not like a huge number of people, but folks who I do know who have gone into teletherapy because they had to, but were very reluctant to, have found it to be, as I have, it worked out relatively well, certainly as well as can be expected. In some ways, and outside the scope of the discussion here, in some ways, telehealth has been, has some advantages in the clinical process. So, but certainly, almost every client, I see a pretty wide range of client situations and client demographics in my practice, and COVID-related stressors are across the board. Everybody is feeling it to one extent or another, even if they themselves haven't been exposed to COVID or had a family member who has. There's just all these different trickle-down effects that are really weighing down on people. And we referenced this before. Providers need to understand that whatever, and we'll just talk about health for the moment, but wherever historical oppression and disparity and racism have influenced healthcare access, it's been exacerbated by COVID. So, and also the other thing that's needed, and I've seen a little bit of this being done with some success in my clinical practice, virtual peer support. Groups that are really offer to me, very critical peer support services like AA, NA, and Al-Anon are moving online as group meetings are just not possible during this time. And that is certainly those groups, but many others, different types of peer support, so critically important for many clients. Okay, and then lastly, on this article, nurses and I added all health disciplines must also advocate for comprehensive public health response that includes attention to the mental health spillover.